Welcome to our in-depth exploration of early warning signs of cancer, a subject crucial for early detection and effective treatment. Understanding these signs can significantly enhance survival rates and quality of life. Let's dive into the often overlooked symptoms that might save your life. Cancer often remains stealthy, showing subtle signs that are easy to miss. Today, we'll focus on scientifically backed indicators, not common misconceptions, providing insights from medical research and clinical practice. Recognizing these signs early is essential for successful intervention. Abnormal nail changes, particularly dark streaks or unusual coloring under the nails, can signal subungual melanoma, a rare but serious form of skin cancer. These streaks, known as melanonychia, appear as longitudinal dark lines and may suddenly change in width or color. A critical indicator of malignancy is Hutchinson's sign, where the pigmentation extends to the cuticle or surrounding skin. Unlike benign conditions, melanonychia in melanoma often progresses rapidly. Immediate medical evaluation is crucial. Early detection through clinical examination and biopsy can significantly improve treatment outcomes. The presence of blood in urine or stool is a critical symptom that should never be ignored, as it can be indicative of several serious health conditions, including cancers of the digestive or urinary systems. Blood in the stool may appear as red, indicating fresh bleeding, or black, suggesting older, digested blood, often pointing to gastrointestinal issues such as colorectal cancer. According to statistics from the American Cancer Society, blood in the stool is one of the most common early signs of colorectal cancer. Similarly, blood in the urine can signify urinary tract conditions, including infections, kidney stones, or more concerning cancers like bladder or kidney cancer. The Urology Care Foundation reports that visible blood in the urine is the most common early symptom in bladder cancer patients. Bone pain that is persistent and intensifies, particularly at night, should be carefully evaluated as it could indicate serious conditions such as bone cancer or metastasis from other cancers. Unlike temporary discomfort from minor injuries or overuse, cancer-related bone pain is deep, penetrating, and remains constant. It often affects the long bones in the arms and legs, but it can occur in any bone. This type of pain may initially mimic less severe musculoskeletal injuries, making it easy to dismiss. However, if the pain persists and is accompanied by symptoms like swelling, increased tenderness, or spontaneous fractures, it becomes particularly concerning. According to studies cited by the National Cancer Institute, primary bone cancers such as osteosarcoma are notorious for causing progressive and debilitating pain, markedly affecting mobility and quality of life. Early detection is crucial for effective treatment. Thus, anyone experiencing unexplained or unusually persistent bone pain should seek a comprehensive medical evaluation to rule out bone cancer or other serious conditions. Persistent heartburn, medically known as gastroesophageal reflux disease, GERD, when it does not respond to standard treatments, can be an early warning sign of esophageal cancer. This type of cancer may start as Barrett's esophagus, a condition where the tissue lining the esophagus changes due to continuous exposure to stomach acid. This precancerous state increases the risk of developing esophageal adenocarcinoma. Research indicates that persistent heartburn, if left untreated over a prolonged period, may significantly contribute to these cellular changes. According to the American Cancer Society, many patients with early-stage esophageal cancer experience chronic heartburn as one of their primary symptoms. Therefore, individuals experiencing ongoing heartburn that doesn't improve with over-the-counter or prescribed treatments should consult their healthcare provider for a thorough evaluation to rule out any serious underlying conditions, including cancer. Early detection and intervention can drastically improve the prognosis. Unexplained pain that persists without an apparent cause should be taken seriously as it may signal underlying health issues, including cancer. This type of pain is particularly concerning when it doesn't correspond to any known injury or medical condition and does not respond to standard pain management. For instance, Persistent abdominal pain could be indicative of cancers like pancreatic or ovarian, while ongoing discomfort or heaviness in the pelvis might suggest prostate or bladder cancer. According to the American Cancer Society, such unexplained pains, especially when chronic and severe, warrant a thorough medical investigation. Diagnosing the root cause through imaging tests, blood work, and other diagnostic procedures is crucial as it can lead to early detection and significantly more effective treatment. Ignoring persistent, unexplained pain can delay diagnosis and treatment, potentially worsening outcomes. Mouth sores that do not heal within a couple of weeks can be a significant indicator of oral cancer. These persistent sores, lesions, or white patches in the mouth, particularly on the lips, tongue, or gums, should prompt immediate medical attention. The American Cancer Society highlights that non-healing oral ulcers and white patches known as leukoplakia are common early signs of oral cancer, especially in individuals who use tobacco or consume alcohol heavily. Oral cancer can aggressively deteriorate tissues in the mouth, leading to more severe health complications if not diagnosed and treated early. A persistent cough or hoarseness that lingers for more than 2 weeks can be a symptom of underlying serious conditions, such as lung or throat cancer, especially if accompanied by other symptoms like difficulty swallowing or unexplained weight loss. According to the American Cancer Society, a chronic cough that doesn't respond to conventional treatments or a change in voice tone could indicate a tumor affecting the lungs or larynx. This is particularly concerning if the cough produces blood or if there is a noticeable change in breathing patterns. Chronic coughing and hoarseness disrupt daily activities and can significantly diminish quality of life. These symptoms warrant a thorough medical evaluation to rule out cancer or other severe respiratory conditions. Early detection through methods such as imaging and biopsy can lead to more effective treatments, potentially saving lives by addressing the issue before it progresses. Unusual skin rashes or marks that persist and do not resemble common allergic reactions can be a subtle sign of something more serious, like leukemia. These rashes often manifest as tiny red to purple spots, known as petechiae, caused by minor hemorrhages under the skin. These marks are typically non-blanching, meaning they do not lighten when pressed. This type of rash is indicative of a low platelet count, a common occurrence in leukemia, where the bone marrow produces abnormal white blood cells at the expense of platelets, essential for blood clotting. Medical journals report that these petechial rashes are often overlooked initially, yet they are crucial indicators of underlying hematologic cancers. Early recognition and medical evaluation are vital, as they can lead to timely diagnosis and significantly improve treatment outcomes. Jaundice, characterized by yellowing of the skin and eyes, is a symptom that can indicate serious underlying conditions, notably liver or pancreatic cancer. This yellowing occurs when bilirubin, a byproduct of the breakdown of red blood cells, builds up in the body because the liver cannot process it adequately due to obstruction or liver damage. Pancreatic cancer, for example, may block the bile duct, leading to increased bilirubin levels. According to medical sources, jaundice may also be accompanied by other symptoms such as dark urine, pale stools, and abdominal pain, particularly in the upper right quadrant. These signs necessitate immediate medical evaluation to determine the cause and initiate appropriate treatment. Early detection of the conditions causing jaundice can significantly improve treatment options and outcomes, making prompt diagnosis and intervention critical. Persistent fatigue or unrelenting exhaustion that doesn't improve with rest is a significant health warning sign that often goes underestimated. Unlike typical tiredness from a long day, this type of fatigue sinks deep, impacting one's energy levels profoundly and persistently. It can be an early indicator of serious medical conditions, including cancer. In medical studies, persistent fatigue has been closely associated with certain cancers, such as leukemia and lymphoma. These cancers affect the bone marrow and blood, disrupting the body's ability to produce healthy blood cells. Consequently, this leads to anemia, which significantly contributes to fatigue. According to the American Cancer Society, approximately 90% of people with leukemia experience profound tiredness, which does not get better with rest. Moreover, fatigue in cancer patients can be exacerbated by the cancer's metabolic demands on the body and the immune response it triggers. It's crucial for individuals experiencing such symptoms to consult healthcare providers for thorough evaluation. Blood tests, imaging, and other diagnostic tools can help determine the underlying cause and facilitate early intervention, enhancing treatment efficacy and improving outcomes. Hence, if you or someone you know is suffering from persistent, unexplained fatigue, it is advisable to seek medical advice to rule out any serious conditions. A persistent fever that cannot be explained by common infections and does not resolve with typical treatments can be an alarming sign, particularly as it might indicate the presence of blood cancers such as leukemia or lymphoma. These types of cancers can cause the immune system to produce inflammatory responses that result in frequent and recurring fevers. According to clinical research, cancer-related fevers are often cyclic and can accompany other systemic symptoms like night sweats and unexplained weight loss. If a fever persists for more than 2 weeks or repeatedly returns without a clear cause, it is crucial to seek medical evaluation. Blood tests and other diagnostics are essential to determine if the fever is a symptom of cancer. Early detection and treatment are vital, as they can greatly enhance outcomes and may provide more treatment options.